Thank you, Mr. Speaker. Would the sponsor yield, please?
Will the sponsor yield?
Certainly. Thank you, Richard.
Sponsor will yield.
In looking at this, I have a couple of specific questions. Would insurance companies that now do business in New York State not be allowed to do any if we have this plan?
Under the New York Health Act, the sale of health insurance that would duplicate any of the benefits of the New York Health Act would be ended. That is correct.
That's correct. Okay, thank you. And what about the insurance companies now, these Blue Cross and all these other companies who operate in New York State, they pay taxes, right?
Yes, they do.
If they no longer were operating in New York State, what would we do about that lost revenue?
Well, when you pump $45 billion back into the economy, you're going to be creating a couple of 100,000 jobs, which is almost 10 times the number of jobs in the health insurance industry in New York. Those 200,000 jobs are going to be paying taxes. Their employers are going to be paying taxes.
And the over 100,000 people, I think it's well over that are employed now in the New York, the ones that do business in New York, those insurance companies, they're going to lose their jobs. We're not going to see their payroll taxes. That's going to be an offset right there. What do we do about that?
Well, first of all, the number of people employed in health insurance in New York is not 100,000, it's 23,000. And as I said, those jobs will be replaced many times over, about 8 or 9 times over, and the taxes, by the jobs that will be created by the money we pump back into the economy. And I also think if the issue is whether New Yorkers can get access to health care and whether they can live with family financial stability, I don't think the economic welfare of insurance companies or the taxes they pay to New York ought to stand in the way of 20 million New Yorkers having access to health care. I think the access to health care is the first thing we ought to be taking care of.
Okay, well, maybe my 100,000 was a higher estimate, but what about not just those people insured in the industry who pay the claims and doing all that, but there's so many people in the ancillary part, brokers, people selling insurance, their staffs. Those are the people who primarily specialize. I was in the business of Blue Cross in a prior life. I worked for the Blue Cross Blue Shield for 11 years. And I know it's a much bigger industry when you spread it out over not just the employees in Blue Cross itself, but all the people who provide the services to them, and especially brokers and other insurance reps. So I will say maybe not 100,000, doesn't matter, whether it's 23 or 100. What do we do about those people who will be impacted very severely, and they will be put out of work?
Well, first of all, the New York Health Act Trust Fund would be authorized to spend money for retraining, relocating workers if needed. Secondly, I repeat, I don't think we should sustain an industry that stands in the way of millions of people getting health care and household financial security in order to protect a jobs program in the private sector for one industry. To me, that doesn't make sense. To me, the health, the medical health and the financial health of 20 million New Yorkers is our first concern. And if we have to provide some transitional funding for people to move into the new jobs that will be created, the bill provides for that. That's what's appropriate. We should not be sustaining an industry that hurts millions and millions of New Yorkers and keeps them from getting health care for that reason.
Okay, let me ask you a different question. This would be, if it passed, this would be mandatory, right? Everybody in New York would have to participate in this plan. There would be no options for them, any other plans. Am I correct in that?
Paying the taxes, of course, would be mandatory. If somebody has the money to pay for their health care out of pocket, we would not prohibit that, but nobody would be selling health insurance for them. And, you know, the reason for that is that crucial to the program being good for you and me and our constituents is for the wealthiest and most powerful of New Yorkers to be in the same boat with the rest of us. And if they're in the same boat in the New York Health Act plan, rather than buying their own separate coverage, it will be the best possible boat for all 20 million of us.
Okay, similar to the Affordable Care Act that was proposed originally, would those people who chose not to participate, even though they might go to a private carrier someplace else if that were possible, will they be required to pay some sort of a tax as was proposed under the Affordable Care Act?
Well,
those people who just didn't participate at all,
yeah,
they had to pay tax.
The New York Health Act tax would apply whether you use the system or not, just like the other taxes we pay apply, whether you have a child in school or whether your house burns down or not, or whether you have a car and use the streets, you pay the tax anyway. So every New Yorker would be paying the tax. No New Yorker would have to pay the much higher costs that we now spend on premiums and deductibles and other out-of-pocket charges.
Okay, if I'm correct, I think New York State has an average of 200,000 employees around the state. That's just the state, not counting some of the local municipalities and governments and all of that. All of those people are now eligible, and most of them do participate in a insurance plan, NISHIP, or the 5 or 6 choices that we get offered every time there's a re-enrollment period. All of those people now would say you cannot have that insurance. We would be telling that you must enroll in the New York Health Plan.
You and I and the other 200,000 state employees would no longer have to put up with unpredictable premiums. We would be deprived of the right to pay large deductibles before the health plan pays anything. If you have a wisdom tooth pulled, as I did a couple of years ago, you would be deprived of the right to pay $1,200 to a dentist and get reimbursed $52. We would be imposing all of those burdens on state employees. They would, all of them, instead have complete choice of doctor, no restricted provider network, go to any hospital they want to, and have the entire bill paid by the state of New York without deductibles or copays or the like. I'm looking forward to that improvement in my health coverage, and I know our teachers are looking forward to it. They've endorsed the bill. The people who teach in our public universities, their union has endorsed the bill. I think it will be a great benefit to all employees in New York State, including the 200,000 who work for the state. And it will be a benefit to the taxpayers because as taxpayers, we will be saving money on their public employee health costs for all the reasons that I said earlier.
I think part of what you said a minute ago was something like 25% reduction in cost. It seems to me that reminds me of something I heard 5 or 6 years ago when what we refer to as Obamacare, or the Affordable Health Care Act, was being touted, and the president was saying you can save 25% of your premiums, and of course all the other statements. You can choose your own doctor, you can keep your health plan, all of that. And of course, none of that came true. None of it at all. And I just think when you're talking about is something that we'd be asked to take the same risk again that was taken with that. Whatever Washington's going to do with the Affordable Care Act or what the president's new ideas, I don't know. But right now in New York State, it seems to me we have adequately pretty good plans available to us. And when you say the exorbitant premiums, you and I and everybody else, we have to contribute to those premiums. When I worked in the private sector, I had to contribute to, as a group plan. I contributed also. I just don't think that what you're talking about will come to pass in the way you say.
Well,
let me go ahead and answer that, and I have a couple other questions.
Okay, the fundamental problem with the Affordable Care Act, and almost every problem that anyone has found with it, is because it is rooted in health insurance companies who were free to pull out of the market, were free to raise their premiums, were free to skyrocket their deductibles. In this country, when we have had universal publicly sponsored insurance, it has actually worked out pretty well. I don't get a lot of my constituents wishing that Social Security would go away. The Medicare program is phenomenally popular, which is why even Donald Trump had to promise he wasn't going to touch it. Not a promise he's likely to keep, but at least he understood he needed to make that promise. Those programs have worked out pretty darn well. And by the way, the Medicare program controls the growth not only of its administrative costs, but of their health care costs dramatically better than private insurance. You know, unemployment insurance, a lot of people think the payments aren't adequate enough, but I don't see a lot of people introducing bills to eliminate public unemployment insurance.
Oh, go ahead.
Public insurance for something like health care costs has worked well in this country where we have used it and would benefit all of us enormously.
You said that one of the features that you said would be of your proposal would that employers would be free of a lot of the administrative costs. Now, having been in that industry for 11 years, I know that employers, the group employers especially, they had a lot of administrative costs, and I can't see how switching from whatever we have now to the New York Health Plan is going to free them up of those costs, especially when their employers are coming to them for help on getting claim service and stuff like that. Claim service is very, very important, and I know that right now the industry, whether it's the Blue Cross plans or the private companies, employ very talented, talented specialists, nurses, doctors, and all of that to do that adjudication of each claim. I don't see that here when you say that they're going to save administrative costs.
Well, the administrative costs that employers would save are things like no longer having to have somebody in the personnel office to take angry calls from the workers, from the company's workers, about their health plan doing one thing or another. Every year or two, if the health plan premium is going to go up, they would no longer have to spend a lot of time and money searching around for a new health plan. They wouldn't have to spend a lot of time and money documenting to an insurance company which of the employees have enrolled in the health plan.
Okay.
All of that adds up to a lot of money, about $2 billion a year.
Okay.
You know, employers don't spend a lot of time and effort administering the FICA taxes that get taken out of our checks automatically.
I'm sorry, but before I run out of time, I have two other questions. First of all, what about collective bargaining? What about the agreements that they have with their employer, with various companies? What do we do about that? We tell them, you have to stop that, and you have to come into this plan?
Well, if it's a collectively bargained plan that buys insurance, there would no longer be health insurance to buy. If the workers have collectively bargained that the employer would pay a higher share of the premium, then they would collectively bargain to have the employer pay a higher share of the premium tax.
Okay.
If they've got a self-insured plan, we can't stop them from doing that, but we can tell them, you're still going to pay the taxes. Our health plan will give your workers dramatically better coverage than your self-insured plan. If you want to keep paying for the self-insured plan, be my guest. I don't think anybody would do that.
What about a non-New York resident, like New Jersey, Pennsylvania, Ohio, who are working in the state of New York for a New York company?
Yep.
And they would have to then participate in the New York plan?
Well, their employer would have to pay the New York Health Act taxes, because we certainly wouldn't want to give employers a financial reason to hire only out-of-state workers. If the employer pays for health coverage for the out-of-state worker, because they're not a resident of New York, so they wouldn't get health coverage through the New York Health Act, what the employer spends on that out-of-state health coverage would be deductible against the New York Health Act tax.
Okay, well, I think I'm out of time. I may have some more, which I'll come back, but thank you very much.